Okay, so for our first view, we are doing a P to A hand. It is done on a 10 by 12 cassette. Here with the P to A hand, you place your hand in the center of the cassette where you have the central ray. It would be directed perpendicular to the third interphalangeal joint. And this is your P to A hand. Okay, here for the medial P to A oblique hand, it will be done on two 10 by 12 cassettes, but we don't have that, so we're just gonna do this. And with this, we'll have to have something to place your hand on as well. I don't have like a tube, so here we are. So here you'll be resting your hand palm side down, and then you'll rotate the hand laterally so that the MCP joint will be at a 45-degree angle. And the phalange should be parallel to the film plane to keep the interphalangeal joints open. The central ray will be directed perpendicular to the third MCP joint and centered to the film. And here is the medial P to A oblique hand. Here for the lateral hand, you will have two 10 by 12 cassettes, and we'll just use this because it's big enough. Here with the lateral hand, you just take your forearm and hand in the resting position, and the ulnar surface is extended so the thumb is away from the metacarpals. Here the central ray will be directed perpendicular to the MCP joint. It will be like right here. So, and here is the lateral hand. Okay, in this view, we'll be doing the P to A wrist. With this, it will be on the 10 by 12 cassette. All four views can be done on this cassette as well. So with the P to A wrist, you want to have your forearm placed in the center of the cassette, and then you kind of want to flex your fingers to place the carpals to contact the film, and then the line would be parallel to the plane, to the film plane. Okay, so where the central ray will be located, it would be in this area. It would be directly perpendicular to the mid-carpal area. And this would be our P to A wrist. Okay, here we are for the P to A medial oblique wrist. Here is all wrists are done on the same cassette. So here we have, you would place the wrist in a P to A position, and then with this you would rotate. You would then rotate your wrist laterally to at an angle of 45 degrees so that your carpals form that degree on the image receptor. And then the central ray is directed perpendicular to the distal radius. And this is your P to A medial oblique wrist. Okay, again, here we are doing lateral wrist projection. So it was just kind of simple. That was flexed at a 90 degrees. The arm is at rest in the ulnar surface. Again, all wrist views are done on the 10 by 12. And here you adjust the forearm so that the line of the carpals are perpendicular to the film plane. The central ray is directed perpendicular to the wrist. And here you have your lateral wrist view. We'll be doing the lateral oblique A to P oblique of the wrist. So the piezoform view, again, we have our 10 by 12 cassette. So with this, you would start with your wrist in a P to A form, and then you will externally rotate it about 45 degrees, where you can see the central ray will be going perpendicular to the wrist, and that is our lateral oblique of the wrist. Okay, in our last shot, we will be doing a special view of the wrist carpal tunnel. So here, since it's just me, if it was the patient, you would have the patient hyperextend their hand, and by placing their other hand on top of their fingers to hyperextend that back, and then you would show the hand should be perpendicular to the image receptor, and then you would rotate the hand slightly towards the radial side if I had the other hand. So if you slightly towards this side, you'll rotate it. And here the central ray will be directed 25 to 30 degrees cephalic to enter the approximately 1 inch distal to the base of the fourth metacarpal. And here is our special wrist view of carpal tunnel. Okay, for our final view, we are looking at the wrist ulnar flexion. With this, it is done on the 10 by 12 cassette as well. So with this, it's kind of like exactly with the wrist P to A position, but with the ulnar flexion added. So here we will be placing our wrist in the center of the cassette. Our central ray will be directed perpendicular to the navicular on our wrist. Here, as we have it in the P to A position, we will then ulnar flex our hand so that it is going away from the radius. And there, you can also, with this procedure, you can use a 20-degree tube tilt toward the elbow if that makes a better view. With this, you're able to see the navicular, the scaphoid bone, and it'll be free of any superimpositions surrounding the carpals. So this is the ulnar flexion wrist view.